To another story we're following tonight, Middlesex London Health Unit is reporting the COVID-19 related death of a teenager who worked at a long-term care home. For more on this, let's bring in Dr. Alex Summers, the Associate Medical Officer of Health in Middlesex London. Dr. Summers, thank you for your time. I know you might not be able to say too much when it comes to privacy concerns, but are you able to share how old this individual was who died? Because it is pretty unusual to hear of someone so young dying from COVID-19.
Yeah, indeed it is. I'm not able to share any additional information specifically about their age. As you mentioned, they were in their teens. They were staff at a long-term care home. And unfortunately, they are the youngest person in our region to have died after being diagnosed with COVID-19.
It is absolutely heartbreaking to hear of this news this evening. Do you believe that this individual contracted the virus while working in the long-term care home?
The evidence that we have to date would suggest that would have been the most likely exposure, yes. It is a reminder about how much transmission we have seen in congregate care settings that house seniors, like long-term care, across this province and across the country, and certainly emphasizes how important these early vaccination efforts are and how important outbreak interventions are as well.
Mm-hmm. Are you able to tell us what this individual was doing within the long-term care home? For example, were they working directly with people who live there, or were they working perhaps maybe behind the scenes in food services?
I'm not able to provide any additional information on that, I'm sorry.
Okay. When it comes to the bigger picture then with this, Dr. Summers, was this individual, did they have any other underlying health issues? And I ask that because, again, we aren't hearing of many cases, especially fatalities connected to COVID-19 in young people.
Yeah, certainly it's a rare occasion and a sad one at that. The unfortunate reality is that as the total number of cases of COVID-19 increases, and we've certainly seen high water marks across the province and here in our region as well, that the chance that someone of a younger age may have a severe outcome like death from COVID-19 goes up. It's rare. It does happen, unfortunately, as these numbers go up, and we're certainly in sorrow here in our region at this time. I don't have any additional information to share with regards to any underlying medical conditions, but certainly a real tragic event for us today.
Mm-hmm. How are the numbers in your region at this point, Doctor, in terms of the number of outbreaks, especially when it comes to long-term care homes?
We saw our peak numbers approximately 2 weeks ago. They are coming down slightly, which is very encouraging. I think we're seeing the impacts of the lockdown starting to take hold in our area. However, we have had, as a result of that high community transmission, a number of outbreaks amongst long-term care homes, some small, some not so small at all. And certainly it's been a real challenge with the high community transmission to keep it out of these long-term care homes. We've had quite a few outbreaks in the last.
Well, we're so sorry to hear of some of those numbers, and of course the loss of this young individual. Dr. Alex Summers, the Associate Medical Officer of Health in Middlesex London, joining us live tonight. Thank you, sir.